Hello everybody, my name is Jasmine Reyes. I'm one of the theater staff nurses here in Our Lady of Lourdes Hospital. And today I will show you how we evaluate the blood loss whenever a primary postpartum hemorrhage happens during a C-section. For obstetric patients who's going to undergo a surgery, it is very difficult to evaluate the amount of blood loss as it involves the amniotic fluid in the blood itself. So our role as an operating theater nurses, it is very essential to have an efficient communication and collaboration among team members. So what we normally do during a C-section is that the scrub nurse and the circulating nurse should have an efficient communication with each other along with the other team members. Say for example, the abdomen has already been started to be opened and about to deliver the baby. Once the uterus has been opened, the scrub nurse's role is to suction the amniotic fluid, and whenever it's going to be accumulated in the suction liners that we have here, which is calibrated, so that's the time that the circulating nurse and the scrub nurse would communicate to each other and agree whether that is the amniotic fluid that's being accumulated when the baby is out. And then from then on, when the blood keeps on coming, that's the time that we have to evaluate and to alert whether, like say for example, it has gone up to 500 mils of blood. So that is the time that we alert the surgeon as well as the anesthetist that there is an ongoing blood loss at that level, so that they would be able to administer or order whatever is needed in order to implement whatever management that has to be done in order to prevent postpartum hemorrhage. And then when a liter has been accumulated on the canisters, that's the time that we have to have an effective collaboration among the team members in order for us to perform what are the protocols that is needed in order to treat the PPH during a procedure. So whenever the circulating and the scrub nurse would notice that from the canister has been filled up, like say for example of 500, that's the time that you're going to alert the operating team for them to be able to know there's an ongoing blood loss during the operation. And then when it goes beyond to a liter, that's the time that you have to have an open communication in order for them to carry out the necessary protocols and for further intervention. On top of the blood that's being accumulated in the suction canisters that we have, the role of the circulating nurse is very essential when it comes to evaluating the amount of blood loss during the ongoing procedure. So in theater, we have respective sizes of swabs that being used during the procedure. So every dry swab that we're using would measure 50 mils. So in one packet, that consists of 5 swabs, and we usually hang it with our swab counters, and that's the time that we have to measure in order for us to have an idea how much the blood loss was. So normally, we roll this up and measure it on our weighing scale. And weigh it as it is. The figures is being shown in the weighing scales, and that's the time that you have to record on the perioperative sheet, the one that we have in theater. So since we have soak swabs here with blood, we'd normally weigh it. So the figure, like say for example, the figure shows 788. So the total dry weight of the swabs that we have is 250. So we do the maths, 788 minus 250, that is 538. So that's the time that we have to write it down and continue to measure whenever there's an ongoing blood loss that's happening during the procedure. It is very essential for us to have an open communication, especially when the evaluated blood loss has been accumulated. This is to alert the operating team in order for them to further manage the PPH. So in every surgical procedure, it is very important that documentation should be observed in order for us to keep a record of the total blood loss that has happened during the procedure.